Here is where endoscopic technique shines. You can finally see the target you're treating under direct visualization. Transect the main nerve with endoscopic scissors or bisect it with bipolar cautery. Then cauterize each end. But don't stop there. The tiny capsular nerve fibers along the facet capsule still matter for pain. Use a small curette or RF probe to ablate those tiny fibers under direct visualization. They're too small to see with the naked eye, but they can still contribute to pain. Conventional RF completely misses them because there's no camera showing those capsular twigs during treatment. The goal is complete interruption of the pain signal, not a partial burn near the nerve. Inspect the junction to confirm a clean, decompressed field. There should be no residual crossing structures. If needed, then turn to capsulotomy or adjacent capsular tissue around it. The lateral branch is unlikely to be injured because anatomically it runs in a different plane. Muscle atrophy from denervation is rare with this targeted approach because the treatment stays focused there. Achieve hemostasis. Manage the capsule as needed. Remove your instruments and close the skin. Use 1 or 2 sutures. Treating 4 facet joints typically takes about 30 minutes in total. Early ambulation is key. Start physical therapy to retrain core stability after the procedure is done. Remove sutures at day 7 to 10. Patients often experience meaningful relief right away after surgery, but the full benefit may take a few weeks as inflammation around the joint settles down. A 2020 prospective cohort followed 40 patients with facetogenic pain after endoscopic denervation. Their NRS pain scores dropped from about 7.1 to 1.5. Their Oswestry Disability Index also improved significantly, and the results lasted for 2 years. Younger patients did best, especially those who only had 1 or 2 joints treated in this cohort. A 2022 multi-center observational study compared 87 patients across 3 treatments for facet pain. Those treatments were endoscopic denervation, cryoablation, and conventional radiofrequency for facet pain in clinical practice. At 3 months, the endoscopic and cryo groups showed greater pain reduction than conventional RF. A 2010 case series followed 178 patients with chronic